Well, I'm delighted I've got with me the Chief Minister, who's agreed to talk about various things that I've asked the audience if they want to hear about. Obviously, Chief Minister, before you say anything more, I mean, the news that we have no active cases now must be fantastic news.
Yeah, it's really good, Paul. If you'd have told me in end of April, early May, when did I think we'd get no active cases, I certainly wouldn't have said the 3rd of June. So we're in a good place. We were nearly there a while back. We had 6 days, I think, if you remember, of no cases, but we had 1 or 2 active cases in between. So we're in a good place, but we can't be complacent. There still could be some people who are asymptomatic out there. In other words, they have it, but they show no signs of it, but they could still potentially be infectious. So we've got to be cautious. We can't relax too much straight away, but we're heading in a position now where we will be able to do further relaxations of restrictions to people's lives in the next fortnight.
And we've got lots of questions about that. And I should point out, we're on a limited time with you. You just have to call this when you have to go to your next meeting. Now we've got no active cases. When will normality be able to come back to the Isle of Man? When's that tipping point, with border controls? I mean, you get asked this all the time, I know, but people are obviously so keen now to try and get that next step, I suppose, to meeting again with people and going overseas.
Yeah, well, obviously we're helping people on compassionate grounds now. We're still flat out trying to get everyone back to the island from repatriation. We have people still scattered around the world who can't get out of regions or are wanting to come back. They may be in their second home for winter sun or whatever, and we're trying to get them back. Obviously, the number of sailings is doubled. It's now 100, 2 lots of 50, and we've announced a small number of people can fly back. So if you fly into London, say from India where you've been stuck, and you can get a flight straight to the Isle of Man, then that's better. Obviously, we've now put in procedures that from the 11th of June you'll be able to do that, obviously with permission from our repatriation team. So we're doing our very best. I think some form of border control is going to exist, Paul, I think, until a vaccine is rolled out.
And that could be any time. I mean, a year potentially, couldn't it?
Well, 1 minute you're hearing it's going to be summer of next year, and then you're hearing, it's only 2-3 months away, August time they might have one. So I take that with a pinch of salt. We will do our utmost to help people get on as much with their lives as possible to the old norm. But I think the 14 days quarantining, for example, will still be around until a vaccine comes in, because even though you can do the test, and we do the test on people, you could have contracted coronavirus, say, on Monday, you're tested on Wednesday, you're tested, say, 3 days later. There's plenty of examples where you don't show any of the signs that you've got it for 10 days or more, and there you could be given the green light and you're allowed to wander around and you would unintentionally spread it.
But
so
there will be the odd one that will come in then, in that sense, because of whatever happens. So we could go from 000 for weeks, and suddenly there could be this outbreak of just one case, and then would you want to shut everything back down?
Well, you would have to follow the spread of it. Obviously, we've got a very good tracing team, so we've done the test and trace. So we've got a good system in place. It's worked well. Show that's proven by today's announcement of no active cases in such a quick time. But so you just have to analyse it. You can never say that you're not going to get any cases, and the only way you would do that is to physically stop anyone coming into the island. I think everyone agrees that you just can't do that. So keeping some form of border control will be going for the foreseeable future, I think, until we get a vaccine. Fine. But anything we can do to help people, we will, of course, do our utmost.
Fine. That's probably about 50% of all the sort of correspondence I get is about borders. Here's one. Since the Road Transport Licensing Committee was suspended under emergency powers, the regulations regarding inspecting buses, taxis and HEVs and the hygiene regs, have there been issues with that? Have they been inspected? And if not, why not?
That's something I don't know anything about, Paul. The detail of it. I can obviously get a written answer and I'll let you know, so you can update that person directly. Obviously, we will be looking in the next couple of weeks to start to get as much happening on the island back to some sort of normal footing. I've already said, the 2 metre down to 1 metre arm's length, as we're saying to people, is something that we hope to bring in to allow more activity on the island and more activity in our schools, etc., and workplaces.
Well, and this one, social security on job centres and so on, when will we be able to go in there again?
Well, they're already working on a plan to open up again. Obviously, they have been working. They've not stopped. I think they've phoned and or emailed 800 and something people of recent. They are doing training courses with people who maybe want to develop skills in another area. So they've never stopped working. But obviously they had to shut, I think it's Niverson House, is it off the top of my head? They've had to obviously shut the offices, but they are now coming up with a plan to get that office open again. And as I say, when you hit about the 15th of June, Paul, and if we still haven't had any cases, then I think there's an awful lot that we would hope to be able to do to make people's lives even easier, to get to what I call the new Manx normal.
Yeah, and hospital visits?
Yeah, well, again, that's kept the hospital, the hospital is coronavirus free. We're starting to open up more operations, for want of a better word, at Noble's Hospital now, more procedures that they had to stop to get the hospital ready for the coronavirus outbreak. So that's happening more. Some people are wanting to go and visit their loved ones, and I know the medics are trying to come up with a way. Is there a safe way that we can allow maybe people in to see a loved one? I think the days, for the time being anyway, have just been able to waltz in whenever you feel like it and spend a couple of hours seeing your loved one. That's gone for quite some foreseeable time. But if they can come up with a system of allowing people in to see a loved one, and it's safe, for the patients, because we've got to remember hospitals, people are there who are recovering. If it's safe for the patient, I mean, it's nice to have a family member come and visit you, but the last thing you want is them inadvertently to give you an illness when you're recovering from something. So they're working on all sorts of issues at the moment to see what can be done to help just general life on the island get back to normal.
The next one's about, I presume, Minister Thomas not being minister anymore, and it's about the situation with the gas. Gas consumers here in the Isle of Man paying over 60% more than off-gem price-capped customers. Any update on who'll be taking over the matter? And now that Mr. Thomas is no longer, will that go to the new minister automatically?
Yeah, minister. That's part of the Minister for Policy and Reform was in charge of dealing with Manx gas. Obviously, I have said I wanted it sorting out as quickly as possible. I've been incredibly disappointed that it's taken so long. Minister Thomas felt he was getting somewhere with them, and then nothing would happen. So I'm hoping that Minister Harmer will be able to get this quickly resolved. I have said that if we don't get anywhere before long, we may have to bring in legislation on this one. It's a last resort, but we can't keep on waiting.
And I know. And how far down the line before you actually do that? Have you set yourself a goal that you need something in place, or you will legislate? Have you given that?
Yeah, I've set a very short time frame. So they've agreed that whatever is agreed will be retro. Will go back to the beginning of the year. So that's fine. But obviously, coronavirus has knocked it back a couple of months. But even if you take into account the coronavirus and Manx Gas having to take a little bit of a back seat, or the agreement, I'm still disappointed that we're not in a position where this has been finalised and they've agreed a reduction in the rate of return on capital employed. There was a meeting the other day with Manx Gas, and my views were expressed on my behalf. To yes,
right. Yeah, I'm getting that impression. Right.
I think they know what my views are and what I want. I want to see an improved deal for the people of the Isle of Man.
Okay.
When you've got a world living in with interest rates down, bobbing along 0 or 1, to be getting the return on capital employed that they're currently enjoying. Everyone has to make a profit, Paul. I get that. I don't begrudge anyone making a profit. That's because you've got to have money to reinvest. So I'm supportive of a profit for someone, but I think the return on capital of 9.99% was just, or in the current world, is too high.
Interesting. Thank you very much. The medium-term COVID-19 strategy, getting updated, it's meant to be a living document, I think you referred to it in that case.
Yeah.
The first viewpoint was the 7th of May, but updates are way past that now. So where are we up to? Can this be updated and posted on the government website?
Well, we've got, obviously Thursday is our big day, Paul. Most Thursdays is when the council ministers meets 3 times a week, and I chair the national strategy group on top of that three times a week too. So we've got another big meeting tomorrow, and once those decisions are made, we'll be giving a press conference as usual on Thursday, and the website will be updated.
This one is also big in the mailbag, and I often ask you it. You slightly look agitated when I ask, but it's about the speed limits. Oh, yeah. So it took mere mortals 24 hours to put the whole thing down, and now it's taken at least 17 days to lift it to 60.
Yeah, well, we took advice. We're in a good position. The number of accidents has gone down threefold, I think. If memory serves me correct, you're in the same period where we've had about 46 accidents, would have expected 150. But that said, there's an awful lot less cars on the road at this moment in time. We brought this measure in to reduce the pressure on our hospital from accidents during the coronavirus. We didn't bring it in through the back door to bring in an all-Ireland speed limit. So we felt, on the advice we were given, instead of just lifting it totally, if we announced a date 15th of June that it would go up to 60, and then hopefully by the end of the month it will disappear. That was the correct way of doing it, instead of just suddenly taking the brake off overnight. Let's do it in 2 stages. So that was the advice we were given, and we respected that advice.
Was that from the police advice, or what?
Yeah, we got feedback from the police on the best way, from the chief constable, on the best way to go back to the old days of the speed limits of 20, 30, 40, 50 around the island, and then unrestricted elsewhere.
Okay,
and it was felt that the way we're doing it,
the future thoughts on speed limits, and you've made that clear that it will be done, if it's going to happen at all, it will be democratically done, right?
Yeah, that's right. We brought this measure in purely to help the hospital fight coronavirus, not via the back door. So whether you're for or against, that's a matter for the future. We are restricting this because that measure is no longer needed so much. So that's why we're doing it.
Right. Could we ask Mr. Quayle, he got the monthly cost of the pandemic so wildly wrong. I'm not sure it's you, actually. I think that's been more in general. But anyway, it was based on £100 million per month, when in reality it's been £20 million per month. Is there anything that can be retrospectively done to save jobs and businesses?
No, I think whoever's stated that has got that totally wrong. We estimated, based on Treasury figures, that you would have a loss in revenue of about 70 million and a month, and a loss and the cost of the 6 schemes that we've come up with to help businesses and protect people's jobs of about 30 million a month. So it's 20 million not opposed to 30 million. It's too early to say what the reduction in income will be from revenue from tax receipts. So it may well be that the figures put out were too high, but it's too early to know that. It'll be months, I should imagine, before we get the sort of data that shows, was it nearer the 100 in total? You had 70 and 30, that's how you come up with 100. So 20 in schemes is maybe not quite as high as the 30. So we'll just have to see. That was the best advice from Treasury at the time. Yep. They had to sort of guesstimate where they were going to be.
Here's an interesting one. The thought, with the Villa Marina being closed, could that space not be used for teaching, as it's easy to social distance in there?
Well, I think obviously we're working with our teacher representatives to get as many of our young people back to school as possible. Obviously, with the good news that we have 0 active cases on the Isle of Man, we would hope that we can speed this up and get more of our young people back to school. I know I was speaking to my good friend, the Chief Minister of Guernsey, who they didn't have that 6 day and then a couple of cases. They are 3 weeks clear, and they've been able to open up an awful lot of things as a result of getting that sort of 3 week period. And I would hope that we can move and work with our teaching representatives to get our young people back to school as quick as possible. One more question, Paul. I'm going to have to go.
Okay, is it correct that dental practices will not reopen on the 8th of June? I mean, where we're up to with dental practice? Do you know?
Well, Not. I don't know the exact date. We're working with them. There's, PPE is sorted out. It's what's known as the aerosol effect in the room and the spread of disease, and getting their protection right, and also but enabling them to come up with a system where they can see more than just 3 or 4 patients in a day, so it's cost effective. So it's something we're working on. Hopefully they'll be back as soon as possible. We are seeing people, emergency with our own dentist that government have, that isn't just tooth extraction now. It is dealing with more with other types of cases too. So we hope to very shortly to be working with our dentists to get back on track.
Fine. And just for me, will Tim have its normal summer recess, or do you think you'll have to keep going as normal, or in the emergency situation, or will there be this long break until October as usual?
Well, we're trying to come up with a system, Paul, where we don't have to come to Tynwald every 7 days with legislation. We're starting to relax legislation now, and we're consolidating a number of legislation into one to make it easier, for the public to understand, and so that we're not having to go to politicians every 7 days and say, look, we need your permission to do this. So we did it with education, with sport. So, for example, the Education, Sport and Culture Minister can now make decisions on helping sports back based on working with the governing body. Clearly we didn't want to be going back to Tynwald every 5 minutes having to do that. So we're trying to be as helpful as possible. Obviously we respect that Tynwald has to scrutinise the legislation, Paul, to make sure that it's right. But we as a Council of Ministers do not want this emergency powers legislation in us any longer than we need to have it, but we certainly, still need to have it for the time being.
But just to answer the question, do you think you will take that long summer break or not, as usual?
I think maybe there will be a number of extra sittings, is my gut feeling. So yes, some sort of break, but not the normal length would be my best guess. But thank you very much, Paul.